We're so glad that you can make it. Thank you so much for making the time to be here. It is so nice to see all of your faces. My name's Talia. I'm the Content and Community Manager here at Hugo Health Kindred. For those of you that don't know, Kindred is building a network of data-enabled people who have been impacted by COVID and want to contribute to research in partnership with leading scientists. I strongly encourage anyone who is not a member yet to join us. You can go to kindred.hugo.health for more information, and it is from Kindred that you can enroll in the Yale Listen Study, led by Doctors Iwasaki and Krumholtz. If you're living with long COVID and live in Connecticut, New York, or Florida, you might also be eligible for the PAX-LC trial, which is now screening on Kindred. So if you all have questions about joining Kindred, about joining any of the studies, I'm going to put a handy resource in the chat as soon as I'm done speaking about all of that. It gives you guides on how to add your records, how to join the studies, how to become a Kindred member, how to find where events are happening, all that jazz. You're also welcome to reach out to me anytime. That's talia@hugo.health. I'm the one that sends you all the emails. So you probably already knew my email address, but, and that's also because I might not be able to keep an avid eye on the chat and get all the questions answered, all the technical questions answered. If you have questions for the task force members or want to say anything about your experience, your journey, your symptoms, et cetera, you can put that in the chat. But like technical Kindred questions about membership, about events, about anything like that, sharing your story, reach out to me, talia@hugo.health. As just a better guarantee that I'll be able to get that answered. And I think that's about it. We are opening the discussion up to all of you today. So in the past, we've had it just be the task force members, and then one other cafe we tried opening up the floor, and it went amazingly. So we really want to continue with that. It was a great way to get to know all of you and for all of you to get to know each other and really lean in and find that support. So we're doing that again today. So if you have something you would like to share or a question that you would like to ask, but you don't want to put in the chat, you want to speak it, you can raise your hand, your real hand, or you can raise an emoji hand at the bottom of the screen, or pick any emoji and we'll call on you by name and unmute you, and then you could speak. We just ask that you keep it relatively short, a few minutes, 2 or 3 minutes, just because there's a lot of people that want to speak. There's a lot, things we want to say. So we just want to be mindful of that. And without further ado, I will pass this off to our lovely task force members. Today we have Liza Fisher, Cynthia Adinig, and Pam Bishop, who will be leading the chat. So first they're going to share a little bit about themselves, and then we'll just go right into discussion. So Liza, if you'd like to start. Okay.
My name is Liza Fisher, and I am from Houston, Texas. I got COVID, and a little bit about my background. I got COVID in 2020, June. It was a little severe. I did end up in ICU, and I was hospitalized for a while. My long COVID just kept going. Like I have symptoms from day one. And then I was hospitalized for about 3 months in 2020. And then ended up needing some surgical procedures from some of the aftermath, and then went down the rabbit hole of all the different post-infectious chronic condition diagnoses and treatments and whatnot. And along the way had gotten involved with advocacy and research, and that led me to meeting Harlan Krumholtz and Leslie and Kindred and joining this wonderful space here. And I'm just really happy to join this community and to answer any questions. I've tried a lot, and I think it's important that we all talk about what we've done and what we want to do, and what we're going through, because this is not easy. So with that, I'll let one of the fellow task members say a little bit about themselves next.
Pam, would you like to share?
Oh, all right. Okay. Hi, I'm Pam Bishop. I am 47 years old. I live in Tennessee. I got COVID in December of 2020. My initial infection was not nearly as bad as Liza's. I was very sick for about 3 weeks though. Was not hospitalized at that time. They really couldn't do anything unless you were short of breath or, had some really serious issues. Mine was very neurological in nature. I was hallucinating and having a lot of sort of head trippy things and a lot of pain. And I got better actually at the end of December. And rather than like Liza's story where she stayed sick, I followed the trajectory that a lot of other people follow, and that is that I got better, and then I started having episodes of, fatigue and pain and brain fog and all of these things, and I was trying to work. I was a professor at the University of Tennessee, and I was the director of my own research center, so it was very demanding work, and I sort of threw myself back into it. Wasn't able to keep up, went on sick leave for a little while, and continued to decline after the 90-day mark. It was just all the time. So I've been going to the Vanderbilt post-COVID clinic since April of 2021. And that's where I got involved in some advocacy work and research, and where I heard about Kindred. I'm in a support group there. And Leslie Krumholtz came and talked to us in Harlan, and we learned about the group. And so I'm just doing advocacy and participating in research as much as I can. I think that's the way forward for us. It's got to be patient-led. And yeah, that's it. I've got neuro-COVID, mostly neurological issues. I've been diagnosed with POTS, ME/CFS, and MCAS so far. I think I also have Sjogren's, but to be determined. So I will pass it to Cynthia.
Hello, everyone. I am Cynthia. I am from Northern Virginia. I guess I have to claim it since I've been here for 10 years now. And I got COVID back in March 2020. It was very mild, just a few days of sniffles, just scratchy throat, kind of like, actually, it's better than what I feel right now with my sinus infection. It was just like sniffles, a little congestion, scratchy throat, no cough, no shortness of breath, no fever. I just knew it was COVID because the entire family had like illness, and we were denied tests at that time because they were only doing it if you traveled or had a cough or fever, or shortness of breath, which none of us had. And so about May 2020 is when I started getting severely ill. It's when I developed what I know now as MCAS, and I started going to starvation because every time I would eat just one bite of anything, I would have an allergic type reaction, and it became very quickly, including all food, and then I was reacting to water. I didn't know what was wrong with me for several months. It was very scary. I almost died of starvation multiple times, was hospitalized for starvation, dehydration. Lost my ability to walk around that time. They didn't really care that much about me losing my ability to walk, so the ERs were still kicking me out and saying nothing was wrong with me and saying it was anxiety. And what catalyzed me into advocacy was an event when I went to the ER. My oxygen was dropping, my heart rate was going up, and they threatened to have me arrested for seeking care. And so that I just decided then and there that I was going to become an advocate, and I've done a lot of things with members of Congress. Alongside Liza, honestly, she kind of undersells herself. She's amazing, has done a bunch of crap that I'm just so proud of. And we launched an organization called BIPOC Equity Agency to tackle this on a broader level, because one of the things that I learned after getting diagnosed with MCAS and ME/CFS and long COVID, and I probably have shortages too, is that chronic illness healthcare is a mess and has been for forever. And we need to think about this more broadly as well. And so I'm happy as a person that's 3 years into this, even though I'm currently flaring, to be here and work with Leslie and the entire team at Kindred. Is phenomenal, honestly, underrated. And I'm happy to talk to the patients because I usually don't get this chance to do that. So excited to be here.
All right, thank you all. And now does anyone else want to ask a question or share?
I will make a comment here real quick. I know we all just shared most of our long COVID spaces, and I don't know how many people on the call are vaccine injury.
Mm-hmm.
I did have I had negative reactions to both of my vaccines. I developed one new symptom, but most of my experience was just like backtracking. Like it sent me 6 months back in my rehab. So like I was functionally walking a little bit, and then I was like back bedridden for a few weeks. So that was kind of like what my vaccine injury was like. So please, I don't want to, just because most of the people are sharing their long COVID experiences, we have a lot in common.
Yeah. Same for ME/CFS too. Now, with ME/CFS, there was vaccine injury in the ME/CFS for forever. So it's always it doesn't have to have this like divide. It's only been this divide like since COVID, but pre-COVID, pre-pandemic, those who experienced vaccine injury and had this cluster of symptoms would, as long as, especially if they have PEM, would have been considered ME/CFS. Same way we are.
Susan has her hand up. Was trying to
Oh,
trying to have
Susan.
it.
Sorry, thank you.
Unmute. Okay, can you hear me?
Yes.
Hi, I'm Sue Kolowski, and thank you for all you are doing. Your stories are truly making me cry. I am from Boston, and when you speak of chronic illness, I go way back with that. I had I'm 67 now, and my son, when he graduated college, had undiagnosed Lyme, neuropsychiatric Lyme, and I'm very embedded in the Lyme community. So I know totally what you're referring to with chronic illness. Just, it's a mess. And he lost 6 years of his life, and he's now doing better. And then came COVID, and after everything I know about Lyme and autoimmune, I drank the Kool-Aid, and I was completely healthy, worked out probably 3 times a day, and worked full time. I did yoga, lifted weights, ran, and I had 2 COVID vaccines. I got Moderna then, and I was feeling fine. Got COVID, was not very ill at all. Had monoclonal antibodies at the time because then Delta was surging and they were giving monoclonal antibodies. And then I got a shingles shot, which I don't know why I did that. My PCP insisted I got a shingles shot. I've been delaying it since I turned 60. And I started having numbness in my toes. But I'm really strong, and I just kept working out, and it was fine. And my daughter was getting married, and I got my next booster in April of 22. And then I got my second shingle shot, because you have to get your shingle shots very close together, otherwise it's not effective. So I think a perfect storm happened in my body, and I developed extreme bilateral neuropathies in both feet. So I'm just curious, and I'm functioning but I can barely wear sneakers. I have good days, bad days. I have a little bit of tinnitus, but I tried IVIG, and that was not successful. It exacerbated my symptoms. I don't know if anybody here is familiar, I did the Bruce Patterson panel. He's a guy out in California that's running blood work. And I did come back with very high S1 protein markers and cytokine markers. I have actually both markers for long COVID and vaccine injury. And I don't know, just searching for answers. And I'm curious if anybody else, I've heard that this neuropathy in the feet is definitely something. So if anybody else has any stories they want to share, but I'm kind of a combination of long COVID, even though I was never that sick with COVID, and definitely vaccine injured. So thank you for all your support and help, and the community. It's just, it does provide some relief to everything we're going through when you have community.
Thank you for sharing, Susan. Kim, I see your hand raised.
Sorry, can you hear me?
Yes, we can.
Okay. So I too have a lot of neurological issues stemming from long COVID. I contracted COVID the end of December 2020, before vaccines were even available. I'm an RN, and I was working in a hospital, and my unit became one of the long COVID units. or one of the COVID care units in the hospital. I contracted it in full PPE, double mask with, properly fitted, N95 mask, 2 surgical masks over that, face shield, goggles, hair covers, surgical gown, double gloved, and foot covers, and I still caught it. The initial COVID, it was pretty typical of the beginning COVID cases. Sorry, I still suffer from word finding, so bear with me. High fever, cough, shortness of breath, racing heart rate, chest pain, incredible cough, the whole thing. I was hospitalized twice. Thankfully, I was never in the ICU, never needed to be intubated. It was more like an overnight thing, get my heart under control, get my oxygen levels a little bit under control, and then send me home. There were no treatments that they even knew of yet back then. You couldn't get ivermectin or anything that was being studied at that time. So basically I was just sent home with like metoprolol or, albuterol inhalers, things like that, to try to just manage the breathing and the heart symptoms. Started to get a little bit better, but still had a lot of issues, diagnosed with MCAS, was pretty much reacting to everything. Still with the lung issues, the heart issues, had costochondroitis that I was diagnosed with. Probably about March is when the neuropathy started. It started with just like a pins and needles, almost like, or like a fiery kind of feeling, like just like my different parts of my body were on fire. It was mostly my legs, but would go into my arms and my hands as well. Slowly, I did the MCAS treatment with H1, H2 blockers, prednisone and things like that. And that did clear up the MCAS quite a bit, to where my breathing and shortness of breath was better. My blood pressure was still sky high. Heart rate was still sky high. I could just be sitting in my heart rate would be in like the 140s. Prior to COVID, I was very healthy, very active, worked out. I was a professional natural bodybuilder. I was in the best shape of my life. And my doctors have said that that's probably the reason why it didn't kill me. So we'll fast forward to September of 2020. And I had an episode of full body paralysis. And they thought I'd had a stroke with locked-in syndrome. The first episode lasted approximately 10 hours. And then slowly I was able to move different things. And they, at the time, they just chopped it up and said, long COVID, we don't know what's going on, because all my tests, everything looked fine. I've had everything scanned. The episodes of paralysis have continued. We're almost 2 years into the episodes of paralysis. I also get very severe episodes of myoclonic jerks where my whole body just shakes and I can't control it. In December of this past year, I started having seizures as well. Throughout this, I've been kind of trying to work as much as I can. Luckily, I have a boss who is wonderful, and I think I miss more time than I'm actually there. Still with the brain fog, the fatigue, severe exercise intolerance. Anytime I try to do anything active, it just exacerbates the symptoms. Obviously, trouble with word finding, memory issues. Like I'll look at somebody that I know and have known for years, and I can't remember who they are. Can't come up with their name. It's just been very debilitating and depressing. And sometimes I'll put it right out there. I wish COVID had killed me, because this is not living. And I'm so thankful to have found the Yale study and Kindred. And so far, it looks like I've been accepted into the Paxlovid study. My husband and I contracted COVID for a second time in January of this year. It was a very, very mild case. My doctor immediately put us both on Paxlovid. And I have had 2 of the best months that I've had in the last 3 years. I was almost symptom-free, was able to function, was going to work, was back working out, seemed like I was getting my life back. And slowly, I think the Paxlovid started wearing off. And I've just been continually doing research on different treatments and modalities to try to help with this. And I'm really excited about this Paxlovid study, because I think more than the 5 days is really going to be key to getting us all through that.
Thank you so much for sharing.
Ken, get you have your hand raised, and then I want to answer, come back to some of these questions in the chat.
Hi, everybody. My name is Ken Todd. I'm from New York City, and just wanted to say hello and thank everybody for their participation in this and being so honest in all of their symptoms. Short version of my story: got COVID January 2021, pretty mild case. Within 2 weeks, started having long COVID symptoms. I've been treated at the Mount Sinai long COVID clinic. I have dysautonomia on the POTS scale, although not classic POTS. The other unique symptom I have is a vestibular dysfunction. And it took us months to figure this out, but it's manifested in eye movement. So when I'm reading or looking at computer screens, it basically makes me motion sick, which obviously was a big impairment for work. I've slowly gotten better over time. I had taken a 6-month medical leave, had a disability accommodation at work because I was denied some long-term disability benefits, and my company was great in recognizing long COVID under the ADA and accommodated me that way. But I've since I'm now unemployed because of a corporate restructure, which I think is going to be a great thing because the summer heat really affects my symptoms, which is the dysautonomia. So I have retreated to northern Michigan for the summer and hopes that a cooler weather will allow me to do more exercise. I find that I can do exercise, but I can only do it till tolerance. And I'm slowly working back. I was a marathoner doing CrossFit before all this, so I was in great shape as well, similar to Kim. And I'm starting to be more active. I also raised my hand for the Paxlovid trial, but because I'm in Michigan for the summer, I can't participate. So if it's still happening in the fall when I get back to Michigan or New York City, I hope to be able to participate. So I've also started volunteering with the COVID-19 long hauler advocacy project to help moderate some of their forums and just kind of start to understand what they are doing. I'm very interested in continuing to get involved in advocacy. That's my story.
Thank you, Ken, for sharing. A lot of similarities in there. I'm going to go back to the questions a little bit ago, and I think part of that was already answered in the chat there. What markers indicated vaccine injuries and what you can get tested. And Susan went ahead and put some information in there on how to get a hold of the Bruce Patterson blood test. Did you want to say anything more about your response on that, Susan?
You're on mute.
Just mute.
I just want to let everybody know he's a little controversial because he does. Listen, I learned this in the Lyme world. There's a lot of people out there trying to profit on the misfortunes of others, right? It's very sad state of the world. That said, I think his blood work, I posted the website, and also I have a Lyme psychologist that helped me. She saved my son's life, seriously. But she's now getting in, she herself had Lyme and her 3 kids had Lyme. And she's getting into long COVID. She was the one who told me about this guy, Bruce Patterson. He's getting a lot of press. He was a virologist. He's an MD, PhD out of Stanford. But he owns, there's a little bit of him. He owns the company that's doing the blood work. So, a little bit of a conflict there. That said, I think the blood work to me was very validating, just to know, to figure out, like, I'm not crazy because I look fine, right? We all have this invisible disease. Knock on wood for me, you guys, I'm going to cry. Like, so many people have like they can't get out of bed. I look fine. It's all in my feet. So yeah, they send you order the kit, they send it to your house. I told my PCP all about it. You know, she thinks I'm a little crazy, but she said, yeah, you can come here and have the blood work done. They measure some things at like VEGF. I have it behind me. They are also using artificial intelligence. They can measure the level of S1 proteins in your bloodstream. They can measure cytokines in your blood, levels of inflammation. There's also something they're measuring non-classical monocytes. Again, I am in accounting. I know nothing about this. I think the blood work is valid. I really do. I don't, and the other thing is though, I don't think you need to go back. Like if your symptoms start to get better, you don't need to keep paying the money to try to get the blood work done. It is expensive. And then they do a Zoom call with you to review it. Their protocol is somewhat controversial. I don't know if the Kindred study advisors are willing to comment on that. And you can even Google it and read some positive and negative stuff. One of their drugs, which I won't take, is an antiviral drug. There's just very little science behind this protocol, is what I would say. So beware about that. They are recommending a high-dose statin, Maribara, which was an HIV drug, and LDN. But going to order the blood is pretty simple. The kit came to me in about 2 weeks, and then I got the results. And to me, it was just confirmed that, yeah, there's truly something wrong. I was told I had celiac disease and a lot of other things. So does that answer questions? I don't want to talk too long and take up other people's time.
So. Thank you.
Okay.
Yes, thank you for the additional information. Everybody can do their own research and use their discernment on whether you want to go down that path.
Thank you.
I do want to say on that note, just anything that comes up today in the chat regarding treatment, like these are all just suggestions. We're not saying go do this. Definitely have a conversation with your doctor, do some research. These are just suggestions for what has worked for people in the community and not medical advice by any means.
And going back to another question, it was to Pam and to, I think all of us have all of these diagnoses, actually, ME/CFS, dysautonomia, POTS, the gambit. When did you start pacing, and do you do exercise? Have you been advised not to exert yourself? And this person has gotten worse over their time and fear that they won't be able to continue to go to work or exercise because of their illness.
I can speak to that briefly. I didn't know I had ME/CFS for the first year of my long COVID, and I was pushing myself, and I was trying to exercise, and I was trying to keep up my full-time job. And I just kept getting sicker and sicker, and I didn't understand what was happening. And it was only I was diagnosed with POTS first. That was a little bit more obvious because I was getting lightheaded and fainting and all of that. I had to do the research on ME/CFS and bring it to my doctor and say, hey, I think I have this. What do you think? I don't have an ME/CFS doctor. So what I've learned, I have a dysautonomia doctor, but I don't have an ME/CFS doctor. Obviously, there aren't very many in the country. What I've learned from the community. And, I read something someone wrote the other day that, pacing is not it's not a treatment, it's a necessity for living or something like that. But I think pacing and resting are really, honestly, the only things that really work. Doctors have tried stimulants on me, but with ME/CFS, stimulants are just giving you false energy that you're borrowing from the future. And at some point you're going to have a really bad crash. So, maybe someone else has a different take on any of this, but what I had to learn really the hard way was that resting is the only way to make it through life with ME/CFS. And that's easier said than done. Obviously, we all have lives. I have children. My children are 12 and 15. They keep me busy. I don't want to miss out on their lives. And I push myself for instance, today my daughter had a tennis match and I went to watch her and I really felt horrible. I had my earplugs in. I was trying not to talk to people, but yeah, resting before you think you need to rest. It's really the only thing that works for me. So I don't know if anyone else wants to chime in on that.
I see a couple hands raised. Kim actually had hers raised before Todd or Ken, and then we'll go Tracy. Oh, just a moment.
Okay, sorry. So I actually got kicked out of physical therapy. I failed physical therapy horribly because I started having episodes while I was there. And it just made it worse. I discovered pacing probably maybe 2 months after we had taken the Paxlovid back in January, and it kind of seemed to be working at first, and I was able to kind of get back. That's how I got back working out and getting back into the gym a little bit. And then as the Paxlovid, I think as it wore off, I failed the pacing as well. And went back to, I couldn't even do like a minute on the treadmill at like a 1.1 speed with 0 incline without my heart rate being like 160. Or any other type of exercise, trying to lift weights or anything, my heart rate was just going insane. And then it started really exacerbating the symptoms with the paralysis and the myoclonic jerks and the syncopal episodes and things like that. So I had to give up on the pacing as well. And now I don't really do much of anything because I'm afraid to. So I wish it worked for me.
If I could jump in here, Liza, what I've been using, so I like most people, didn't understand ME/CFS going into this or know anything about it. And for those of you guys that haven't heard about it before, it's myalgic encephalomyelitis chronic fatigue syndrome. And it's basically what a lot of people from a wide variety of either post-viral, post-infectious triggers, or even asymptomatic triggers or surgeries, even or vaccines, develop this cluster of symptoms that's very, very close to long COVID. And I thankfully was adopted basically by some people who have had ME/CFS for decades and saw me struggling in and out of the ER. And I didn't understand why painting with my son for 30 minutes would land me into the ER when I could do that for several hours pre-COVID. I'm just sitting down. It wasn't doing anything. I don't understand. And so they were able to help me to audit in my actions and understand what my body was telling me and what signs it was telling me when I was getting close to that point. And I learned how to listen to my body, and which was great which really helped my recovery and exercise. So when I got to physical therapy, when I finally found someone who cared enough to give me physical therapy when I was not walking for several months, I was able to safely do the physical therapy because they were able to tell me to be very, very cautious and know that those physical therapists generally are not trained to be gentle enough for our bodies, and that we have to be very cognizant not to overdo it and learn on our own where we stand on the amount of exertion we have and be firm about, okay, I can't really do this. And so that has helped me tremendously. And if you saw me walk around today, you would have no idea that I ever was needed a wheelchair or walker for several months, because I've been able to slowly regain it based off of, I think it's called the anaerobic threshold that I used for myself. And then when my son flared last year, I went straight to use that so that he didn't decline to the point of becoming bedridden like I did and have all of these nerve damage or anything else. And so I use that when I'm checking him with his pulse oximeter, and I'm checking his oxygen and his heart rate. And then so what I do is, if I do an activity, check your heart rate the next day. If it's worse, then you know that was too much. Go back down to what you do. That's how you kind of can really gauge where your limitations are. But the one thing, last thing I'll say is, what's really, really, really vitally important that changed my life was mental exertion is just as taxing and can trigger you just as bad as physical exertion. And as a proud nerd, it was really, really hard to give up reading legislation, reading research, doing all the other stuff that I like to do for several hours, deep diving into new information, learning about immunology. I've had to like slow go that against my will because it will trigger me. And so if you guys are still having a real difficulty in finding your levels, understand that you need to be calculating your mental exertion into what you do during the day as well. That is a major, major catalyst of a drain to your energy. And I write a bit about some of it on Kindred. If you guys want to look at that, I wrote it's the Talia. It's the 5 things I would do differently or something. I think
I'll post it in the chat now.
Yeah.
Good call out. Yeah, it's a great art.
And Ken, you've had your hand raised.
Yeah, sure. Cynthia, I'm right with you on the mental exertion and social exertion as well. I consider it like the trifecta: physical, mental, and social. And in fact, social is some of the hardest for me, including doing things like this, because I'm projecting and exerting that way. In terms of the pacing, I wanted to call out that I found a great physical therapist in New York City. He was trained on the protocol developed by Dr. David Petrino at Mount Sinai. And my physical therapist was totally invested in understanding long COVID. I found that exerting laying down was the first place to start. And then slowly moving to things that were more upright, doing things on your back, on the floor, going to recumbent bike and things like that. So that was how I started pacing. I've now been able to work up to, I can jog a mile. I wouldn't say run, jog a mile, rest, and jog another mile. I've been able to do that about once a week over the past 3 or 4 weeks. But to Cynthia's point, I also, and Pam's point, proactive resting. I take a nap every day. If I feel like I don't need it, I always regret it later on. It's just built into my schedule. And that's what really gets me through the day. I find that if I successfully do exercise where I don't overexert, I tend to do better throughout that day. But like when I do that higher exertion, I will finish, I will lay down for a while and rest, and then I will later take a nap. It's almost like proactive, preemptory resting is what really works for me.
Thank you for sharing. Cathe, I think you had your hand raised next.
Hi, I just wanted to talk some about pacing as well. I was diagnosed with post-viral syndrome in July of last year. I had gotten to see a neurologist who was testing people in June, and by July she had come back with this diagnosis that yes, I had post-viral. And I too am like 99% sure that mine is a vaccine injury, because I'd been so careful. I didn't go out, was always wearing N95 masks and all that. I was the most careful person I knew. And so I hadn't had any COVID in case on, and it was April 2022 when I started having symptoms. I didn't even realize what was happening to me at first because I knew I was so careful, and so I didn't think there was any chance of me having had an asymptomatic case. But I had been, all through the pandemic, I had been following all kinds of virologists and immunologists. And in fact, that's how I heard about Dr. Iwasaki and the Listen study. And I had seen a lot of people with long COVID commenting about having something called PEM, something called POTS. And so I was like, I don't know what those are. Let me look them up. So when I looked them up, I went, oh man, this sounds like me. And it was, I think I said it was like 2 weeks after my 4th Moderna shot. And so it just seemed like that must have been what triggered mine. But anyway, to go back to what I wanted to say about pacing, I got the diagnosis in July of last year, and I thought I was going to have to cancel my trip that I'd planned to see my dad for his 97th birthday. I'm in New Orleans. He's in Northeast Iowa. And I didn't plan on getting on a plane because of COVID risk. And I'd been planning to make the 2-day drive up there and then back. And so I had to say, gosh, I'm sorry. I just don't think I can come. But then miraculously, about a week before I would have to leave, I realized that I'm feeling pretty much normal. And I continued to feel good. So the day came and I said, okay, jumping in the car, I'm going to make this drive. And so I did. 2 days up, spent some time with my dad. Then I drove up even farther to Minneapolis to help my son find an apartment. Spent like a couple days there visiting cousins and getting the apartment and all that. Drove back down to Iowa, another little day and a half with my dad, and then hit the road again for the 2-day drive back home. And all that time it felt just fine, and had done a whole lot of stuff. On the second day of the drive home, after breakfast, I'd walked to and from the breakfast room a couple of times, and I just suddenly just was collapsing on the bed. And I'm like, I can't do anything. Luckily, I was able to get up again after a little while and drive home. But ever since early August then of last year, I've been in a crash. So I just wanted to say, if you find yourself, hey, yay, I'm back to normal, take it slow and easy. Don't trust it. I'm again starting to feel a little bit better. But then again, a couple days, last weekend, I had a really bad crash. So I'm not going to trust any I'm feeling better feelings until they've lasted at least 6 months, I think. So that's it. That's my deal.
Thank you for sharing. Jeff, you've had your hand raised.
Yes, thank you. I wanted to echo Cynthia and Ken and add a little something to it as far as what my doctor calls post-exertional brain malaise, using the brain resulting in feeling crappy. I have 4 kids here between the ages of 9 and 15. And one of my doctors said, hey, don't try to double task anymore, even though, we all do that. So, try to do that. So that's really, really helped me. And the social exertion, same here. It's really hard. It's really hard to talk and engage with people. It makes me feel worse. And I just wanted to point out that it's really hard because it's countercultural in this country where workaholism is glorified. Resting when, like you all are saying, it's so wise what you guys are saying. And it's really, really hard for me to do. Resting, when you're driven to stop, to cease everything, resting is not an option. We do that, right? Whether it's the flu or something. But when you feel like so-so, it's really hard, but I'm trying to get better at it. And then when you're feeling good, continuing to rest is a beautiful thing. And I just think it's a great goal for all of us. I also had a question for both Liza and Cynthia. Well, especially Cynthia, you mentioned in your story that you were arrested. And I just wanted to ask, you know, if being a person of color has anything to do with that, and if you'd speak on that for those people in the meeting who are treated even worse than us white people when we talk, because there's a lot of gaslighting. That's the number one complaint in these calls, even for us who have some certain privileges that others don't. All right, thanks a lot.
Thank you. And Cynthia, do you want to speak to that?
Yeah, I'm glad you brought that up because it's definitely on par with what I saw. I also saw, because I was in the ER, I think around like 30 times in the first 2 years. A lot of it. So I found out later that hospital had drug tested me without my knowledge several times for my long COVID symptoms. And I've asked them multiple times why, and they don't answer. And they got to the point where I stopped giving them my urine, because the second I would step in the door, they didn't want to give me an IV for my pods. They didn't want to do anything else. Even after I got diagnosed with all these things, I still continue to be criminalized. I wasn't arrested, but they definitely would have. There was security there. I mean, I filmed it because I knew that no one would believe me from my past experiences with them, that it was just going to be my word against theirs. And so even though there's like a no filming policy, I filmed it because what are they going to do? Sue me? I have all this medical debt from them not treating me properly. So I was not concerned about that. And so I did what I had to do. I filmed it, and I have no regrets. I continue to film what I experienced, such as in January when I was experiencing anaphylaxis from a flare. And they triggered the worst anaphylaxis reaction I have ever had the misfortune of having. And for the first time, my throat completely closed up. And when I'm in a flare, I'm very wobbly. I can't walk well. So I was in a wheelchair when I was in the ER when this happened. And I had told them beforehand, hey, I am in a flare. I am prone to reacting to everything from food, water, air. Be very careful. And even when I was warning them and saying, hey, please, by the way, I'm having this reaction to the saline, it was to saline that I had a million times before. But again, I was in that hypersensitive state, so I knew I could react to anything and had to warn them. And as the reaction was happening, they ignored it. They were just like, oh, well, we're just going to take you to your nurse. So they're pushing me along in a wheelchair slowly. I'm like, hey, nurse, by the way, I really could use my Benadryl, my prednisone right now. Like, I need my medicine to counteract this allergic reaction. My throat's closing, and then they're just completely ignoring, like, oh yeah, we're fine. She's just pushing me casually. And to the point where my throat closed, I stopped being able to breathe. My chest was heaving uncontrollably in a way I've never seen before. But I knew that based off my last experience, that if I had gotten up to try to run or do anything, they absolutely would have tackled me, did all kinds of stuff, and that really would have killed me. And so I sat there as my throat was closing and just had to hope and pray that my own body was going to reverse it on its own. Thank goodness it did. But if it hadn't, you guys would not be talking to me today, because even after that, they didn't give me a call button for hours. They still didn't immediately give me any sort of like medication to reverse it. Even after I explained to them, like, hey, this is my MCAS, I'm diagnosed for this, you can look at my stuff, they've treated me for this before. Just ignore. They treated it like it was a panic attack. And then when I, followed up with the hospital later, they just can't be bothered at all that they almost killed me. And so yes, a lot of it is just sheer neglect and apathy for brown life. And may I also say that when I was actually over there, I noticed that they put me into the space where the severely dangerously, like physically dangerous, mentally ill. And so the entire time that I'm sitting there in the bed coming down from this reaction, I have very violent men just thrashing, yelling, cursing, saying how much they hate women, they want to die. They have the police that's over there handcuffing the guy, and he's like maybe 10 feet away from me, crawling on the floor. Another guy is over there lunging at a nurse in a separate room. And that's when I realized that I was in the most heavily policed space. I think it was like 2 police that patrolled at all times in front of my room and about 4 security officers. And I realized, like, wow, yet again, even though I have all these diagnoses, they're still treating me as a danger, even though they literally had to wheel me into the room. And so you're correct. And it doesn't change. And that's why, even though I've done a ton of work in advocacy, I want to do more on the local level. I want to do more on the policy of hospitals. So I will be going around with Liza Fisher to different hospitals and trying to pitch some solutions, not just for the bias that I experienced from a person of color, but I learned from the MECFS community and even the Lyme community that this is not new. The psychologizing of our illness is not a new thing. And this needs to be sweeping changes, especially in ER in terms of education, so that we can actually get proper treatment. They can stop harming us and we don't have to be scared when our heart rate is dropping or when we're in the shower and we're feeling faint to go to the hospital to get care. Like, we shouldn't fear that. Like, that shouldn't scare us. But I actually am terrified now and won't even try other medications haphazardly, because I know from my last experience that if I do have an adverse reaction and I have to rely on the hospital, they're not going to care about my life at all. So, and it's sad because I'm a very visible person. You would think they know who I am. Like, they know that I've spoken to Congress. They know that I've done all this work in advocacy, and yet they still could care less about my life existence or survival. And so I know that we've lost a lot of people of color that we're not even counting. And I have a lot of privilege to go to a variety of hospitals, but unfortunately, it doesn't matter what hospital I go to. I tend to get the same treatment. So I will keep fighting the good fight as long as I live to change this for not just me and people of color, but those who English is not their native language. I have seen some horrible, like the most, and the unhoused. It's horrible. It's just horrible for so many. And so that's why I don't just do this work for post-viral illness or long COVID. I really want to do this for everyone to get adequate care in the hospitals. But thanks for asking.
Yes, I echo a lot of what Cynthia said and have many personal stories, but in the interest of time, I want to get to Paul, who's had his hand waiting. Just a moment, you'll be able to unmute.
Hi, I just want to reach out. One of my issues besides PEM is insomnia, and it's just terrible. I have no trouble falling asleep, but an hour, 2 hours later, I wake up and I can't get back to sleep. Constant sleep interruptions, and I'm just wondering if anybody has any solutions or ideas they've tried, even different drugs they've tried or supplements. I've tried melatonin. That seems to just make things worse. I did try one actual sleep drug. It was actually a like an antidepressant drug, but commonly prescribed, and that also made things worse. I felt worse the next day with that than I did if I just didn't get any sleep. And I'll not sleep. I'll sleep like a couple hours a night for maybe 4 days in a row, and then I'll finally sleep, and then maybe I get 6, and then the whole cycle starts over again. And so I just want to reach out and, hear if anybody's found a good solution for that. And that's all.
Thank you, Paul. There are a couple of comments in the chat if you want to check that people are sharing. Personally, I can say that I probably tried the same drug you did, and then I've tried like 4. Trazodone seemed to be what worked for me, but I don't like to stick to it. And then I guess I'll be really honest, I will go with cannabis products, CBD, CBN, things like that, anything natural, and trying to get to as much of a sleep cycle and living my life according to when my histamine cycles and dumps are. But, that took time, a lot of time to figure out.
All right. Thank you all so much. We are at time now. There's
Speaking of time.
Yeah, there's so much comments. There's so many comments going on in the chat, and this is great. I would love to keep this conversation going on forever. But luckily, we have a ton of events coming up this summer. So we have a another Kindred Cafe July 27th with Dr. Lindsay McAlpine. And she specializes in neurology, neuroinfectious disease, and the neurological sequelae of long-term effects of COVID-19. She directs the Yale COVID Neuroclinic, which treats patients who have recovered from the disease but have persistent neurological symptoms, including headaches, neuropathy, and cognitive impairment, among others. So she'll be joining us on Thursday, July 27th at 4 p.m. ET. And then we also have another Listen Study Town Hall. So that's open up to Listen participants only. If you're not in Listen, they're still enrolling. You can join today. And that's going to be on Thursday, July 20th at 5 p.m. And then we have another Kindred Cafe scheduled. Very exciting. Dr. Jim Jackson is returning. He's going to be talking about his book, Clearing the Fog, which actually I think came up in our last Fireside chat. And that's going to be Thursday, August 24th at 6 p.m. ET. Another thing I wanted to mention is the chat. There's so much advice and, tidbits about things that have worked for people. And if you want the chat, you can shoot me an email, talia@hugo.health, and I will send that out to you. I will not be sending it out to everyone. I did that last time. Not going to be doing that this time, but if you would like the chat, you can send me a request and I will send that to you. And that's it. Again, reach out to me with any questions at any time, talia@hugo.health. If you have ideas for events or gatherings for the future, please let me know. We encourage feedback. I love hearing your feedback. If you want to share your story on Kindred, you can also connect with me, talia@hugo.health. You see that we kind of post weekly, people sharing their stories about recovery or about finding support or about really anything under the sun. You can reach out to me. But thank you all again so much for coming. This was another incredible event, and I'm just so happy to be a part of it. So I hope to see you next time. Have a great evening.
Thank you, guys.
Bye.